my name is Salomon Manier. I'm a hematologist from Lille University in France, and so we've been reporting the data of the safety running cohort 1 of MajesTEC-7 with the combination of teclistamab, daratumumab, and lenalidomide. And I think it's interesting to see in the field of multiple myeloma, we've had recent progress, and we are still in a learning curve with those bispecific antibodies. So the data are very encouraging in terms of safety and efficacy, but we are facing new challenge and new complications that we need to learn to manage. So I think the main challenge or point with bispecific antibodies are the initial step up of the treatments. So we do a small dose, an intermediate dose, and the full dose after within a week time period. And during this time, the patient can develop this CRS, cytokine release syndrome, with fever and multiple unspecific symptoms. And sometimes they can develop also what we call ICANS, so this neurotoxicity, but it's less frequent. So the CRS is something that we learn to manage. We can manage it quite well. We follow the patients in hospital for this initiation of the bispecific antibodies. And if the patient develops fever, it's prolonged fever, or if they start to have low tension or some hypoxia, we can give them tocilizumab. So this is the main drug of the cytokine release syndrome. And I think the second aspect that's specific of these bispecific antibodies are the risk of infection. And what we observe in MajesTEC-7 is that it's mostly in the first 3 cycles that the patients will do the grade 3 or 4 infection. So this is where we need absolutely to have the full prophylaxis against these infections with cotrimoxazole, with valacyclovir, with IVIG supplementations, try to cover and minimize as much as possible this early risk of infections. So this is what we are learning on the road, and we hope that we'll even improve the management of those patients in the future.